Hello and welcome to Fact File as we continue our conversations with leading physicians, doctors, trying to understand how the disease is spreading and most importantly, how do we understand it better and what should be done even at this point as we cross the 1,000 mark, well over 1,000 mark, and what should be the preventive steps that you should be taking. And joining me today from Mumbai is Dr. Hemant Thacker, who is a consultant and senior physician at Jaslok Hospital and Breach Candy Hospital, both in South Mumbai. Dr. Thacker, thank you very much for joining us today. So I understand that you are treating one patient who has tested positive for COVID-19.
Yes, I am. But fortunately, this patient is not so symptomatic. He happened to have fever of a low grade for 3-4 days. Fever went up, began with a cough. We tested him, but he's a young man. He's 40 years old, and he has no issues as far as breathing is concerned, as far as hydration is concerned, no other comorbidities. So we have treated him at home, quarantined him and treated him at home, and which is the way we will have to be forward. Because if you're going to put every COVID patient in the hospital, we don't have beds. We need to reserve the hospital for the sick patients who need assisted treatment, which means they cannot do something on their own. They can't take oxygen on their own. They can't monitor themselves. They can't ventilate themselves. They can't eat or drink, so they need intravenous medication and things like that. So, so far, so good. The patient is doing well. It's day 9 for him, and he's doing quite well.
And any idea or thoughts on where he could have contracted it?
Difficult, but he says that there was somebody in the building who was sick and taken to the hospital, but he doesn't know more about that. So maybe it's a COVID positive patient, and they were moving freely about in the building before the official lockdown came in. So maybe that's what it is.
And so no history of travel?
No history of travel.
Right. So
whether that patient had a history of travel, we don't know.
Right. And where we are today, Doctor, week 2 of lockdown, and for some people who have been perhaps early in to adopt even week 3 of a lockdown in Mumbai city specifically. And then when you look at the numbers, which are obviously now rising quite rapidly, and we've seen the largest ever rise in the last 1 day. So how are you correlating?
That's because of faulty lockdown. I mean, the Chinese enforced lockdown at the point of a gun. We are cajoling them. We are soft soaping them. If you had not got those lockdown defaulters, if you want to call it, whether they were in Sangli, Delhi, or wherever, your numbers were still good. But obviously, this is like a super spreader. You meet, you collect, you discuss, you cohabit, you feast, and then you spread. I mean, this is what the virus is loving.
Right. So, when you look at these numbers, and as you said, to some extent, maybe the lockdown hasn't worked, or it did not work when it should have worked in the early part. What is it?
6 days into the lockout, our numbers were still, our graph was flat.
Yes, but that would assume that we were testing aggressively, and which we were not, right?
No, but then India is a country where there's a paucity of kits. So what are we testing? We're testing the patients who were symptomatic. Right. Now, remember, only 15 to 17% of COVID patients are symptomatic. So if such few are symptomatic, and if you extrapolate those numbers, you will find that the remaining 80 or 85% were asymptomatic, which still is small. Such small numbers, if you extrapolate the 80-85%, in a population of 1.3 billion, numbers are small.
Yes. So if you look at the numbers that are rising for as they are, and for whatever the reasons, including the ones you mentioned, and the fact that, let's say, in Mumbai now we have parts of the city or small parts of the city which have been completely quarantined. So how do you look ahead? I mean, that's really my question. I mean, are you able to project forward, and what do you see?
I was very happy until till yesterday afternoon. I go into the hospitals where I'm attached. I was quite happy. But now seeing this, I mean, how many places are you going to close and how much are you going to quarantine? We will, this is what community transmission is all about. That you meet in the community, you share in the community, and you disperse in the community. And it's quite scary now with so many people catching it, with so many buildings. You need only one super spreader to enter the building, and then kaboom, the whole building is blown up. So if this continues, then we're going to have an explosion of cases.
Right, and when you've looked at cases in the past, and I know you've written about other similar epidemic, and definitely not pandemics. Are you seeing any similarities, more from a point of view, our ability to actually contain the spread of this virus or even cure
Well,
patients?
Indians, I'm hoping and still I'm hoping because of their innate immunity, their ability to live with tuberculosis, combat it, or cohabit with tuberculosis. The fact that we are a malaria prone country and we've lived with malaria, we have lots of infections. We lived with H1N1 and we still have H1N1, but now we have H1N1 behind us or by our side, and we still are happy to live because and in spite of H1N1. So one is hoping that one will sooner or later, whether it's the immunity, whether it's the temperature, whether it's the flat curve, will help to dilute the dose of the virus and Indians will be able to shrug it off. And that is my fond hope. It is
Right.
definitely a more virulent infection. What H1N1 did to the lungs, if you compare to this, is nothing. This one is a galloping cytokine storm creating virus which will kill within hours and it will overtake and cause multi-organ failure. So
Right.
definitely we are anxious, we are worried. Till we don't tame the wild horse, we can't afford to ride with it. And
Right.
taming the horse is extremely important. And you have to begin by not touching the horse first. Let the horse calm down, and which is social distancing, which is quarantining, which is staying at home.
Right. And what's the treatment path that you are adopting, for your existing patient and
Yeah,
likely to for
it's
future?
giving a cocktail of azithromycin, hydroxychloroquine, and two antiviral drugs. And it has worked there. Nobody is clear on the combination of antiviral drugs. Everybody knows that hydroxychloroquine and azithromycin are the mainstay. Some people add remdesivir, some people add oseltamivir, some people add. There are lots of antiviral drugs.
And this seems to be the path that most doctors world over are taking.
Correct, correct. I mean, medicine is learned not like mathematics, but by experience. So, from the experience of our colleagues, maybe in China, maybe the world over, this seems to be the most plausible cocktail to employ, which is what we are doing.
Right. And as you look ahead, and what are you telling your patients? I don't mean patients as in people who are specifically afflicted with
I'm
COVID-19,
telling
but people.
my medical fraternity and my medical population that I treat that you have to be patient. The next 2 weeks of lockout has to be so perfect that you chase the virus into a corner and do not allow it a stepping stone to get any close to you. And if you are careful, you probably will be able to distance it, one by physical distancing, two little sporadic small cases in the community will dilute the effect, will reduce its virulence, will prompt it to mutate, and will dwindle slowly. This is not like a pressure cooker where the whistle blows and all the steam is out. It's going to take a while. It's going to take a while.
Right.
This is a game changer. It's going to change the way we live, the way we practice medicine, the way we socialize, and the way we now navigate ourselves into the rest of our lives.
Right. Dr. Thacker, thank you so much for your time and wish you all the best and strength
Good luck.
in your task.
I join you in strengthening the hands of the country to fight this menace. Good luck to you too.
Thank you so much. Goodbye.
Bye. Okay.